Bismillahirrahmanirrahim. Assalamu alaikum. I welcome you all to my YouTube video channel Comprehensive Pharmacognosy Review. Today's topic under discussion is multiple choice questions. But before that, hi everyone, I am Tariq Sultan. Question number 1, salbutamol. Part A. Takes about 1 hour to produce bronchodilation. Part B is a selective agonist at beta-1 adrenoceptors. Part C should be stopped if it causes tremor. Part D must be taken regularly. Part E may be valuable for acute left ventricular failure. Let's discuss multiple choice answers and explanations. Question number 1, Part A is false. The effect is almost immediate. Part B, answer is true. Although salbutamol has greater affinity for beta-2 adrenoceptors, beta-1 adrenoceptors are stimulated, especially at high drug concentration. This may lead to tachycardia. Part C, answer is false. Tremor is common but rarely bad enough for drug withdrawal. Part D, answer is false. Salbutamol is usually taken when needed for wheeze and dyspnea. And lastly, answer of Part E is true. Given IV, salbutamol induces marked vasodilation, beta-2, as well as bronchodilation. It is not a first choice of drug for left ventricular failure but can be useful. Question 2, ipratropium. Part A is a nicotinic antagonist. Part B may cause intraocular pressure to rise. Part C is of no value in the treatment of acute severe asthma. Part D causes a dry mouth. Part E encourages oral candidiasis. Let's discuss the multiple choice answers and explanations. Question number 2, Part A, answer is false. It is a muscarinic antagonist. Part B, answer is true. This may result from systemically absorbed drug, but it is more likely that part of the aerosol reaches the conjunctiva and is absorbed locally. Antimuscarinics cause the pupil to dilate, that is mydriasis, and this may occlude entry to the canal of Schlemm. This is only relevant if the patient has closed angle glaucoma. The answer of Part C is false. It is of value in the management of acute severe asthma. The answer of Part D is true, like atropine. And lastly, the answer of Part E is false. Inhaled steroids do this. Question number 3. The following statements are true. Part A, doxapram is preferable to mechanical ventilation for young asthmatics with severe respiratory failure. Part B, in acute severe asthma, the inhaled oxygen concentration should be low, that is 24 to 28%. Part C, ciprofloxacin has no effect on the disposition of theophylline. Part D, glucocorticoids potentiate the effects of salbutamol. Part E, antihistamines have no place in the treatment of acute severe asthma. Let's discuss the multiple choice answers and explanations. Question 3, Part A, answer is false. Doxapram is occasionally useful in patients with type 2 respiratory failure and allows inhaled oxygen concentrations to be kept high without worsening hypercapnia. Young asthmatics with severe respiratory failure will rarely benefit from doxapram, and its use will waste valuable time. Such patients need to be ventilated. Part B, answer is false. Oxygen concentrations should be high, that is 40%. To try to correct hypoxia, caution is only needed in patients with chronic type 2 respiratory failure. Blood gases should be measured in all cases of severe respiratory distress to help to resolve this issue. Part C, answer is false. Ciprofloxacin is an enzyme inhibitor and reduces the clearance of theophylline. Part D answer is true. Glucocorticoids interact with beta-2 agonists pharmacodynamically by upregulating the expression of receptors. And lastly, Part E answer is true. Their use confers no additional benefit. Question number 4. Inhaled sodium chromoglycate. Part A is beneficial in chronic bronchitis. Part B is beneficial in acute severe asthma. Part C may cause hoarseness. Part D is beneficial in allergic conjunctivitis. Part E is anti-inflammatory. Let's discuss the multiple choice answers and explanations. Question 4. Part A answer is false. Chronic bronchitis is secondary to mucosal damage, usually from smoking, and exacerbations are caused by infection. Part B answer is false. Chromoglycate is only of prophylactic value. Part C answer is true. Part D answer is true. And lastly, Part E answer is true, though the exact mode of action is unclear. Question number 5. Drug hypersensitivity reactions. Part A may involve more than one hypersensitivity mechanism. Part B may cause renal failure. Part C should always be treated with systemic steroids. Part D may cause joint pain. Part E usually occur upon first drug exposure. Let's discuss the multiple choice answers and explanations. Question 5. Part A answer is true. The division into types 1, 2, 3 and 4, hypersensitivity is convenient, but adverse reactions can involve more than one mechanism. Part B answer is true. Drug allergy may cause renal damage by inducing vasculitis or interstitial nephritis. Part C answer is true. Systemic steroids may be needed for life-threatening disease, but most drug reactions settle quickly upon withdrawal of the drug. Part D answer is true. Arthralgia and arthritis may both be a consequence of types 2 or 3 hypersensitivity. And lastly, Part E answer is true. Previous exposure is usually required. Question number 6. Histamine H1 antagonists. Part A have a major role in the treatment of asthma. Part B have a major role in the prevention of asthma. Part C should not be combined with alcohol. Part D have a major role in the treatment of anaphylaxis. Part E may cause dyskinesia. Let's discuss the multiple choice answers and explanations. Question 6. Part A answer is false. Part B answer is false. Antihistamines are of little use in either setting. Part C answer is true. Antihistamines are sedative. Part D answer is true. After epinephrine, that is adrenaline, has been given subcutaneously, an antihistamine such as chlorpheniramine should be given IV. And lastly, Part E answer is true. This is not a common adverse reaction but is well documented. I hope you have enjoyed this video. It's bye for now.